Hello everybody, my name is Casey Ulrich, and on behalf of the National Nurse-Led Care Consortium and the American Association of Nurse Practitioners, I would like to welcome you to today's webinar, Transform Your Practice with the Care Transitions Network. Today's webinar is being recorded and will be available in the upcoming week on our NP-SAN portal page. A link to the recording will also be emailed to all registrants. All participants will be muted throughout the presentation. I encourage you to submit questions throughout the presentation. Please use the Questions tab on your GoToWebinar control panel, as seen here, to ask your question. It will be relayed to the presenters and answered at the end of the webinar. Also, a survey will pop up at the end of the webinar and be sent in an email later on this week. Please take a few minutes to complete the survey evaluating this activity, as your feedback is critical to the ongoing development and presentation of our webinars. We have the slides for today's webinar prepared for today's presentation, which you can access via the Handouts pane in your control panel. You can click the handout and it will download to your computer via your web browser. So I'd like to take a quick moment and introduce ourselves. The National Nurse-Led Care Consortium and the American Association of Nurse Practitioners have teamed up to develop the Nurse Practitioner Support and Alignment Network. The Nurse Practitioner Support and Alignment Network encourages nurse practitioners to participate in the Transforming Clinical Practice Initiative, or TCPI, the largest ever federal investment in peer-led quality improvement training. The TCPI can help NPs prepare for payment reform through connection to free quality improvement networks. Today we'll introduce you to one such network. The Care Transitions Network is working to help organizations and their clinicians adopt the changes necessary to succeed in New York statewide initiatives while also staying tuned to their true north, improved quality of care for people living with serious mental illness. Participating clinicians receive individual clinical case consultation, training to support adoption of evidence-based practices, and coaching on the transition to value-based payment arrangements. This network is for both primary care and behavioral health providers. My co-presenters, Kate Davidson and Elizabeth Arend, will discuss the Care Transitions Network in greater detail. So again, my name is Casey Ulrich. I'm the Director of Practice Transformation and Quality Improvement with the National Nurse-Led Care Consortium. And I would like to take a moment to quickly review the general structure of the TCPI program, the impetus behind the program, how it's constructed, how it serves enrolled clinicians, and more. And again, my partners will provide a deeper overview of the Care Transitions Network and how it is supporting clinicians in New York State. So, CMS is providing around $700 million in funding towards peer-based quality improvement. And we know that they're not doing this out of the goodness of their hearts. They want to use this program to help clinicians prepare for the transition to payment reform, and in particular, payment reform that's occurring under MACRA. I know many of you have probably heard of MACRA. The first thing to know is that it's a piece of legislation that was passed that's established Medicare's quality payment program. It hasn't been finalized yet, but under the quality payment program, there are two mechanisms that incentivize tying quality to Medicare Part B payments. There is the Merit-Based Incentive Payment System, or MIPS, as well as encouraging clinicians to participate in advanced alternative payment models, or advanced APMs. CMS believes that most clinicians will end up participating in the quality payment program through MIPS. Now, the details of MIPS haven't been finalized yet. All we have is the suggested rules for the MIPS program. But the trend is what is most important, is what's important for nurse practitioners to understand. MIPS involves 4 things clinicians need to do to succeed and receive boosts to their Medicare Part B payments. That is, report on quality, report on resource use, the component of fee-for-service that is never going to go away, identify clinical quality improvement activities that they're engaged in, and use health IT effectively. And this is the section of MIPS that essentially takes over where meaningful use left off. So while the quality payment program has not been finalized, and while many of you may not end up participating in the particular MIPS component of QPP, what is important is to know that these 4 aspects of MIPS are what we believe every clinician will need to do to be able to succeed in a value-based payment environment. So even if MACRA and MIPS doesn't apply to you, we believe if you can do these 4 things effectively, report on quality, report on resource use, identify and engage in clinical quality improvement activities, and effectively use health IT, you will be in a position to succeed in a value-based payment environment. And the TCPI and the practice transformation networks, and in particular the care transition network that you're going to hear about more this evening, are meant to support clinicians as they build the skills necessary to perform these 4 activities and succeed in a payment reform environment. So having talked a little bit about payment reform, I want to discuss the structure of the TCPI. It is a national network of peer-based quality improvement networks. These networks share change methodologies, tools, literature, and technical assistance across their enrolled clinical membership. And again, they are there to help clinicians prepare for transition away from fee-for-service to a value-based payment. What we have here is a brief illustration of the clinical journey an enrolled clinician and their practice would take as a participant in the TCPI. It would begin with setting aims. It would then move to using their clinical data to drive changes and improvements in care, all in order to help achieve progress against those aims that they've set, then to achieve benchmark status, and finally to thrive as a business via pay-for-value approaches. Here are the overarching goals of the TCPI. Now, I don't need you to take in all of these together, but I just wanted to show these to you so you can see what a large program it is. CMS is planning on enrolling actually greater than probably 150,000 clinicians. They want to see millions of Medicare, Medicaid, and CHIP patients affected and touched by TCPI services, and they want to realize billions of dollars in cost savings. So when thinking about how this TCPI project works on the ground, it's through the practice transformation networks. CMS has funded 29 practice transformation networks across the country. There are a few that are national in scope, but most of the practice transformation networks have a distinct geographic area. Just like the Care Transitions Network is working specifically with clinicians in the New York area. They provide the free boots-on-the-ground technical assistance and services to help realize practice transformation, to help clinicians set concrete goals and examples. Again, Elizabeth and Kate from the Care Transitions Network will give you concrete examples of the services they're providing to move clinicians through that path that I showed you earlier and prepare for payment reform. If, however, you're on this call and you're not in the New York area, you may not be able to join their practice, but the services that they're discussing and the process of enrollment is indicative of how these practice transformation networks are operating across the country. So I still encourage you to stick around and hear how it works, and later on we can help find a practice transformation network that is particular to your geographic area. CMS also funded 10 support and alignment networks, and that's exactly what we did here at NNCC and AANP. We teamed up to create the Nurse Practitioner Support and Alignment Network. These support and alignment networks function as critical project partners to the practice transformation networks. We're here to make sure that clinicians are aware of the TCPI and understand its importance and help match you up to a network that fits your needs. So NNCC and AANP are partnering to ensure that there is full participation of nurse practitioners in the TCPI program. Outreach and education to membership around the TCPI is our initial step. Then we're going to be providing referral services to link NPs to the networks that best fit their needs. And then finally, we're going to be developing TCPI-specific educational content to help nurse practitioners and their associated clinicians move through that clinical journey that we discussed earlier. We believe that this is a very important program for nurse practitioners, and that NP involvement for CMS means greater access to uninsured, at-risk, and underserved populations that they're likely to work in. And it also means greater access on the part of CMS to federally qualified health centers, rural health centers, and other safety net clinical settings. Just quickly, here are the goals of the NNCC and AANP project, the Nurse Practitioner Support and Alignment Network. As you can see, we want to recruit 7,100 nurse practitioners to enroll into a practice transformation network like the Care Transitions Network. And again, we're going to be developing NP-specific educational resources, oftentimes with associated continuing education, to help move through the TCPI change package. And finally, the overall goal of this project is to make sure that NPs can thrive and succeed in a value-based payment environment. So I've discussed a little bit about how TCPI works. Now I want to discuss how NPs are particularly suited to benefit from and thrive as part of PTNs in a value-based payment environment. So we know that NPs have a large and growing role in the delivery of healthcare in the United States, especially in primary care. The number of licensed NPs is growing, the number of visits, and we know that a high number, as the last count, around 84%, are prepared in primary care. Yet oftentimes in the past, NPs were sometimes unintentionally excluded from quality improvement initiatives and payment reform initiatives that were rolled out at the federal level. Again, sometimes this was unintentional. Sometimes it took a little while for the federal government to recognize the growing importance of nurse practitioners in care delivery. But as a result, participation in many incentive programs and other quality improvement programs is still low for nurse practitioners compared to physicians. That's why it's important to note that this isn't the case with the TCPI. CMS included nurse practitioners in the design and implementation of the Transforming Clinical Practices initiative. We feel that the TCPI represents an opportunity for NPs to not only shape the way that the TCPI program is rolled out, but to a certain extent shape the trajectory of payment reform, as we know that the practice transformation networks are going to be sending data and critical feedback back to CMS around what's working and what's not working for clinicians as they prepare for value-based reimbursement. And so NP participation is critical in order to make sure that their experiences are represented in that feedback. We also think it's critical to understand that this TCPI change package and that the curricula that CMS has introduced as part of the TCPI embraces principles of nurse-led care. These include things like patient and family engagement, working as part of a team-based care environment, practicing as a community partner, using evidence-based care, enhancing access. And then we also see that the TCPI aligns with existing priorities for many nurse practitioners. This could include medical home recognition, the greater use of health IT, as well as aligning with many metrics and priorities that have been voiced by the Division of Nursing. So I'd like to talk about how the TCPI can benefit nurse practitioners, as well as how the TCPI could benefit from nurse practitioner involvement. So NPs can help practice transformation networks by serving as leaders in their networks. As I mentioned, NPs are very familiar with many aspects of the change package. Nurse practitioners also have experience working in collaborative, interdisciplinary, team-based environments. And NPs also have experience participating in peer-led quality improvement activities. And the TCPI can provide quite a bit of support to nurse practitioners and nurse-led practices. PTNs can provide nurse practitioners and nurse-led health centers with critical resources for practice improvement. And again, Elizabeth and Kate are going to go into the particular resources that their network is providing. The practice transformation networks also represent access to larger clinical peers. We know that many nurse practitioners work in smaller practices and that many nurse-managed health centers may be located in hard-to-reach areas, and the TCPI represents an opportunity to interact with and work on critical healthcare quality improvement activities with a larger peer network. And finally, the TCPI has a focus not just on the individual clinician, but their entire practice. They believe that improvements to really make a difference have to be rolled out not just by any single clinician, but by the practice as a whole. And so not only you, but your colleagues will also receive support and services from the practice transformation networks. So to get involved, the purpose again of the Nurse Practitioner Support and Alignment Network is to create that that best fit and find that network with the best fit for you and your practice. We'll find a network with the correct geographic and population focus, a network with the right mix of technical assistance and training services to address your needs, a network with the right clinical quality improvement focus, and with the right quality measures chosen to make sure that it reflects the care that's being delivered to your population and the services that you're providing. So how do you get involved? Well, the easiest way is to go to the Nurse Practitioner Support and Alignment page of AANP's website. You can see that link there. I also encourage you all to join the TCPI portal at healthcarecommunities.org. If you create a free registration there, you'll receive developments and updates about the TCPI, and you can join our particular Nurse Practitioner Support and Alignment portal page, and we'll use that to share announcements about upcoming webinars and training events, new free resources, as well as continuing education opportunities. And then finally, if you think that you would like to join up with a network, whether it's Care Transitions Network or another network in your area, please feel free to shoot me an email. My email address is right there, or my colleague at AANP, Chantel DePape, and we'll do what we can to answer your questions, provide you with more information about the TCPI, and connect you to a network. So, having given that introduction, I want to now turn the presentation over to, again, my colleagues from the Care Transitions Network, and I will give control to you, Elizabeth, and let you talk a little bit about your network and the services that you're providing.
Thank you so much, Casey, and thanks to everybody who's joining us this evening. We're really excited to discuss the Care Transitions Network for people with serious mental illness with you. Let's see. So my name is Elizabeth Arend. I'm the Quality Improvement Advisor, and I'm at the National Council for Behavioral Health based in Washington, D.C., and I'm joined by my colleague. I'll let her introduce herself.
Hi, this is Kate Davidson. I'm the clinical advisor, and I also work for the National Council for Behavioral Health.
So I'll walk us through sort of an overview of the Care Transitions Network, and please, if you have any questions along the way, please feel free to put them in the chat box, and we'll have a little time at the end to answer your questions as well. So to start, I know Casey provided a great overview of the the Transforming Clinical Practice Initiative and what a practice transformation network is. So we'll go into a little more detail. So as Casey said, there are 29 PTNs all across the country. The Care Transitions Network for people with serious mental illness is part of this initiative and the only one of all the PTNs to focus on primary healthcare practices and behavioral health practices that serve people with serious mental illness. We are also one of the 3 project options for the Office of Mental Health's Continuous Quality Improvement Initiative. So enrollment in this network will enable your practice to access technical assistance, clinical consultations, and incentive payments, and fulfill OMH's QI initiative participation requirement. So if you have no idea what I'm talking about, we will go into that in a little more detail in a minute. But we're really excited that we are the only PTN in this initiative to focus exclusively on improving outcomes and efficiencies for practices that serve people with serious mental illness. So the goal of this initiative is to facilitate progress through what CMS calls the 5 phases of transformation, right? All 29 practice transformation networks will support more than 140,000 clinicians across the country to make it from the first step, which is setting aims, all the way to the point where you're ready to thrive as a business through value-based payment systems. Ultimately, though, this is all to achieve the triple aim, to improve patient experience, improve health outcomes, and reduce per capita healthcare costs. So just to make sure we're all on the same page, I always include this slide. What are value-based payments anyway? Well, there's a big shift going on, and I'm sure many of you are familiar with this. There's a big shift going on from fee-for-service, where payment is dependent on quantity of care rather than quality, to value-based payments, which is a model that rewards healthcare providers for meeting certain performance measures that are related to quality and efficiency. And New York is all over this. So for all of you audience members who are practicing in New York, you know exactly what I'm talking about. New York State's goal is for 90% of Medicaid payments to be made through value-based payment arrangements by the end of the 5-year Delivery System Reform Incentive Payment, or DSRIP program. And the same is true for federal initiatives through CMS. CMS aims to have 85% of all Medicare fee-for-service payments tied to quality or value by 2016 and 90% of 2018. So this is the way that the world is going. As Casey said, the macro legislation, the proposed rule, and the new merit-based incentive payment program, they may not apply to you for different reasons, but wherever Medicare goes, other payment structures, in private insurers included, are sure to follow. So this is really the main focus of the Care Transitions Network, to make sure that all of our enrolled practices have the support and the technical assistance they need to prepare to thrive, so they can thrive as a business when in the context of value-based payments. So why focus on serious mental illness? Well, first, this is a huge problem nationwide, but specifically in New York State, 673,000 adults are living with serious mental illness. And we know that nationwide, people with serious mental illness die on average 25 years earlier, and this is largely because of treatable comorbid medical conditions. We also know that there's a significant cost associated with this. Between 2003 and 2011, hospitalization for mental illness increased at a faster rate than any other kind of hospitalization. And across 15 states, behavioral health discharges ranked among the top 5 diagnostic categories for 30-day readmission. So what does that mean? We have a revolving door. We see a lot of people in New York State in particular that are readmitted to the hospital within 30 days. And so we know that the system needs a lot of support, and it's important for us to work with inpatient providers, outpatient providers, and make sure that we can support those care transitions. And of course, the table, you'll see the cost associated with this, and you'll see mental health, substance abuse, and those combined health conditions mean that there's a really high rate of potentially preventable readmissions. So our goal is to reduce all-cause rehospitalization rates by 50% for people with serious mental illness by the end of this project. So we're now almost 1 year in, so we aim to do this in just a little over 3 years. So we're doing this with a 3-pronged approach. The Care Transitions Network offers free targeted coaching and clinical support, short-term care transition support, and web-based platforms to track your progress. And so all of this, we provide all of this so you will move through those phases of transformation. And all of the interventions are directly aligned with other New York statewide initiatives like DSRIP and the OMH's Quality Improvement Initiatives. So we'll go into these in a little more detail. But first, I wanted to present this. This is what CMS calls the change package, with its primary drivers on the left and secondary drivers on the right. These are basically fancy terms to describe what you all probably know as the triple aim, right? To improve patient and family-centered care design, to use data for continuous quality improvement, and to make sure that your business is sustainable in the long term. So this, you can look at this like as a menu, essentially, for the technical assistance that we offer. We also describe it to our enrolled members as a framework, and you know, this is how we have designed our technical assistance, and it really speaks to the work that you already do. As Casey said, it really speaks to the principles of nurse-led care, and what your priorities already are, such as enhancing access and making sure that healthcare services are effectively integrated. So when you work with us, this is the framework that we will use. And the beauty of our technical assistance model, and what I've really enjoyed working with our enrolled clinicians, is to help them identify where their strengths are and where they need support. And this has been a really effective framework to identify those areas where they need our technical assistance. So what does that technical assistance look like? So first, we have individualized coaching and clinical support. And we think this is really going to appeal to nurse practitioners who are practicing in primary care and who provide outpatient behavioral health services. So first, we start with the practice assessment tool. This was designed by CMS to measure where your practice is currently located along with phases of transformation. Here's a hint. Most of our practices are definitely in phase 1, so you're all in this together. And we ask every enrolled organization to complete this brief assessment right after they enroll, and we help members use it to set goals and track progress over time. So our technical assistance can help support practices to access the resources they need to reach those goals. That might include monthly webinars to support specific technical areas. We also offer teleconsultation with subject matter experts. We also offer clinical consultation with our team at Northwell Health. They have a group of psychiatrists and an internist who specialize in medical and behavioral health comorbidities. So they're all different kinds of individualized coaching and clinical support that we have to offer. It really just depends on your needs. And this is available to all eligible professionals in each enrolled practice. We also offer customized short-term care transition support, which I think will really appeal to nurse practitioners working in an inpatient setting. So the key indicator here is the rehospitalization among people with serious mental illness. In New York City, you'll see that 24% of people transitioning from inpatient to outpatient care are readmitted within 30 days, and 36% are readmitted within 90 days. And this is directly attributed to missed outpatient mental health appointments after they've been hospitalized. But working with our partners at Montefiore, they've established a collaborative care model. Let's see. There we go. They've established a collaborative care model that has been very effective in increasing the percentage of appointments kept within 7 days of discharge, as well as the appointments kept at the 30-day mark, and drastically lowering those readmissions rates. They are less than half of the New York City average for unmanaged Medicaid patients. So finally, we also offer a web-based platform to track your progress, and we think this will appeal to everybody. Anybody who has ever tried to mine their own claims data knows how time-consuming and difficult that can be. So what we do is we are providing a care manager tool with our partners at NetSmart. And this will provide our members with financial and utilization data on beautiful dashboards so you can track your progress through the phases of transformation. So this might include measures like hospitalization rates, medication adherence, and polypharmacy. And all of this dashboard information will be derived from Medicaid claims data, so you do not have any additional reporting requirements, and you don't have any added reporting burden. We felt that was really important for our members. So we essentially take that claims-based data and send it back to you in a way that is easy to read, easy to digest, so you can use it for continuous quality improvement. By 2019, we hope our members will all be better positioned as clinical leaders for people serving, for people with serious mental illness. They will be locally and nationally recognized as high-performing organizations, and you will be 100% prepared to thrive as a business in this rapidly changing environment. So you're probably wondering, are you eligible? First, we want to say that this network is open to everybody, nurse practitioners who work in acute or ambulatory settings, if you work in behavioral health or primary care, if you're urban or rural. The main eligibility criteria is that your practice must include at least one eligible professional, and this includes nurse practitioners as well as physician's assistants, clinical psychologists, and LCSWs. And what we ask from you is a pretty light lift. We do have an enrollment agreement, which you can check out on our website. We would need licensure and PI and contact information for all of your enrolled eligible clinicians, and we ask that every practice designate leadership, so you can engage your team in continuous quality improvement and sort of be our main point person within your practice. And there are tremendous benefits. So all the technical assistance, the clinical consultation, the web-based platform, all the resources I discussed are free, and they are available for your entire workforce. Even if you're the only person to enroll and you're the only eligible clinician, we recognize that you work in teams and that this technical assistance should be available to absolutely everybody. We also offer up to $100 in incentive payments per eligible clinician. So upon enrollment, there is an incentive payment, and you will get additional incentive payments as your practice progresses through the phases of transformation. We also, as I mentioned before, OMH has a quality improvement initiative and has requirements for that. We are one of the eligible projects that you can sign up for. So you can fulfill that requirement with us. We also offer free contact hours that contribute to CMEs and CEUs with our live online learning events, and there is no minimum participation requirement. So we always get questions about this. There is no minimum number of webinars you have to attend. There is no minimum number of in-person events. All of our resources are available on demand, and they really are tailored to you and the unique needs of your practice. So that's why there are no minimum requirements, because we realize that every practice is different. Even within an organization, we have large organizations enrolled with up to 10 or 15 individual practices, and they're all unique. They all have unique patient populations and different needs. So, so we really take the time to get to know you and make sure that you're getting the specific kinds of technical assistance that you need and that it's worth your while. So next steps, if you're ready, feel free to check out the enrollment agreement at our URL listed below, caretransitionsnetwork.org. If you'd like to, you can also share the attached handout with your organization's leadership and share how you think your organization could benefit from the Care Transitions Network. And if you have questions after this webinar and want to discuss eligibility or enrollment or network benefits, please feel free. You can contact us at caretransitions@thenationalcouncil.org. And I know this webinar will be recorded. You can also look back at our personal email addresses, and we would love to talk to you. So thank you very much. And we will open the line for questions and answers. I'll hand it over to Casey.
Thank you so much, Elizabeth. We're going to now take the remainder of our time for questions. So again, if you do have a question for our presenters, please type it into the question tab on your GoToWebinar control panel, or there's a little hand icon. If you click on that, I'll see that your hand is raised, and I can open up your mic and you can ask your question over the phone as well. So I'll give everyone a couple minutes to type in their questions or think about questions that you might have for Elizabeth and Kate. While we're doing that, we'll look over some that have been submitted. Elizabeth, do you see any questions there from our attendees that you and Kate would like to address?
Yes, I do. There is a question here about the type of, if we could give examples of the type of TA that we've provided. So I might hand the mic over to Kate. Kate, if you could describe some of the technical assistance that we've already provided for our members.
Absolutely. I think a big piece that you hit on, Elizabeth, that's important to just kind of highlight here is that we are constantly tailoring our technical assistance to meet the needs of our organizations, and we do that in a number of different ways. We're tracking on the quality improvement, the types of quality improvement goals that people are setting that are associated with the change package that you talked about earlier. And we're doing an analysis of all that data and then really addressing the webinar topics that we are forming based on people's goals. So an example of that is that we're doing a number of webinars that are really helping people to identify what their population is so that they can begin to make decisions about value-based payments. Another example is that we're going to be helping organizations to collaborate with folks in their own communities, so that as that's a huge piece of value-based payments as well, because no one can make some of these decisions themselves. No one can be really alone as in this current system. They're really going to need to be partnering with people in their own community.
Great, thanks, Kate.
All right.
We do have another question. Oh, sorry. Go ahead, Casey.
I was going to say, we do have one question that came in. One attendee asked, how does participation differ between primary care and behavioral health providers? So is there a difference between, the services that are received or the emphasis of activities for behavioral health versus primary care providers?
So we have both primary care and behavioral health providers that are enrolled. For our primary care providers, we're helping them. A lot of times people are really interested in understanding how to support people with serious mental illness or other behavioral health disorders within their practices. We recognize that people have a major focus on care coordination at the moment, and we are able to provide those services with a lens toward integration because the National Council for Behavioral Health actually houses the SAMHSA HRSA-funded Center for Integrated Health Solutions. And so we have a lot of subject matter experts within our own four walls that we can help to provide access with nurse practitioners who are in primary care settings. We also, our data applies to both primary care as well as behavioral health. Our outcome measures are really focused on reducing all-cause rehospitalization rates. Our claims-based data that we're looking at cuts across both mental health as well as medical facilities. And so we'll be able to pull that information for both primary care as well as for behavioral health. I hope that answers that question, and if it does not, you're welcome to ask a clarifying question and I can go at it again.
Elizabeth, any other questions on your end that you've received?
No other questions on my end.
Okay. There haven't been any others from the audience, so like I said, if there will be a follow-up email that is sent to all registrants with a link to the recording of today's webinar. So if you'd like to share it with any of your colleagues, please do so. You have the contact information for both Elizabeth and Kate. Theirs is at the beginning right here if you have additional questions, and then you can contact us as well. Our contact information is also on the slides there. And when you log off today, there is a survey at the end. Please take a few moments to fill out those very few questions, because again, they really help us improve services offered and craft content that you could use going forward. So any last comments or questions, Elizabeth and Kate?
I would just like to, this is Elizabeth, I would just like to say thank you so much for joining us, and if you are interested in joining the network, please feel free to get in touch. We look forward to speaking with you.
I echo those sentiments completely. Thanks everyone for joining us this evening, and enjoy the rest of your night.